Hello, everyone. How are you? Happy Thanksgiving week. It's Christina here with the Mommy Spot Tampa Bay. I'm so happy you're joining us. We are here with our partners at Tampa General Hospital, just talking about Thanksgiving. And, 2020 has been a little bit of nothing short of normal this year. So, can everyone hear me okay? We're good. Gotta love technology, right? This is the year of 2020. So, it's been a very abnormal year. We don't know what to expect. And now, we're seeing COVID come back. And we're so grateful to have a partner like Tampa General Hospital through this time because I couldn't ask for more availability of resources for public health and whatnot. It's just been a challenge. So we're so grateful to have TGH on board. But today we have Kimberly here, Kimberly Atrovin. She's the manager of infection and prevention at Tampa General Hospital. She's going to be sharing tips on, how to keep our families safe this holiday season. So Thanksgiving's a few days away. We just are really unsure of what to do. So welcome, Kimberly.
Hi, how are you guys doing? I'm very excited to be here. Thanks for having
Thank
me.
you. Welcome to our social distance Thanksgiving dinner.
I like it. I like it. Great job.
I know, I know. So you have been in education and epidemiology. And tell us a little bit more about your background and how you are providing resources to Tampa General Hospital.
Sure. Well, I am, like you said, the manager for infection prevention. I have been in infection prevention for just over 9 years now. And before that, I actually was working at the health department. I worked in public health for 4 to 5 years before that. So this type of environment and providing these types of resources and kind of reassessing our practices and coming up with safer recommendations, I've been doing that for a long time now. So hopefully we'll go over some great things and hopefully your audience will take away at least one or two things that you guys can do this week.
Yes, absolutely. I wish we would have almost done this sooner, but
Yeah.
Thanksgiving's 2 days away. But we have the whole holiday season that we're embarking on. So it's nerve-wracking, with families and getting together. This is the holidays and enter COVID. It just rains on all of our parades sometimes. So, with holidays, you see a lot of family travel, you see a lot of gathering. But specifically speaking with travel, if people are and families are planning on traveling, what steps should they really take into consideration? And do you have any tips to share?
Sure. So the first thing that's really important, and I think no one is going to enjoy this answer, but the biggest thing CDC is really recommending at this point is that there's no travel. And it's a horrible answer and it's not fun. And like you said, it's 2020. It's not the best year we've ever had, right? But this year is really different. We've got the pandemic. The COVID virus is really widespread in portions of the country. So when you're considering travel, it really is going to be dependent upon where you're going or where some of your family members or friends are going to be coming from. And so you really need to take that into consideration. So, of course, right now, the Midwest is really surging. They're having a hard time right now. So if you're headed out there, I would really recommend against it. So travel is the big thing right now. If there's any way that you can incorporate into virtual, like getting some of those family members from far away into virtual, Zoom, I think, is going free for the day. So consider those things. If we can't do that, then the next thing would be what type of travel, how are you going to manage that? So, of course, anything that you can do to increase your safety. So wearing the mask, increasing social distancing, so meaning 6 feet apart from people, that's going to be the best thing. So, of course, you really can't do that in a crowded bus or a crowded airplane. So those things are going to be higher risk situations versus if you're able to drive to where you're going. That would be the best, right? Because then you're in your own car with your own family members. You can avoid crowded areas. So those would be lower risk situations. So that's exactly what I would recommend. If you cannot really get into kind of some of that travel, some of the other things to think about, your influenza shot, that's going to be really important. At this point, it really takes 2 weeks for an influenza shot to really kind of kick in and provide you some protection. So it may be a little late for Thanksgiving this week, but will really be beneficial come Christmas and some of those other winter holidays and New Year. So think about that bit as well.
Okay, so that's interesting. So why do you recommend getting a flu shot now to help, with COVID? If because they're different. or how does that work?
Yeah. It definitely the influenza vaccine will not help you with COVID. Of course, you guys, I'm sure, have seen on the news COVID vaccine. They're working on it. They're looking for the authorization, and hopefully we'll get it soon.
Yeah.
But if you were to get a combined infection with COVID and influenza, the likelihood that you're going to have much more of a severe reaction, or essentially a severe course of illness, increases. So if there is a way to prevent at least one of them, so we know that influenza vaccines are really effective at this point, then at least do that, since we don't have the COVID vaccine yet. Hopefully we'll get that soon, though.
I know, I know. I hear it's coming, and hopefully you guys will be one of the first. But yeah, I mean, it's so interesting, and I think just regardless, the spreading of germs is great, and there's so much unknown, I think, still. Which so I like that tip, so we can get our influenza shots now. You know, Christmas and the holidays are still a couple weeks away, so if it takes 2 weeks, that's great. Now, you know, there's a lot of people that are staying home or staying local with families. If families are deciding to gather, you know, we've obviously set up a mock table here, which we'll go into later. But what are some tips you can provide, or you know, tell us about and show us too, on ways to really stay safe at home?
So some of the basic infection prevention practices, the biggest one, of course, I know you guys are seeing this, is the mask use. It's really so effective, so simple. That would be the next best thing. So if you're still determined to have your Thanksgiving and have your family gathering, then really recommending that persons coming to visit you are wearing your mask. Exactly. And when I'm saying wearing a mask, my expectation is that you're actually wearing it correctly. So you're wearing it over your nose and then under your chin. So it's not like
Yes,
this. Right.
not like
Because you're
this.
not just
Yeah.
breathing through your mouth, right? You are breathing through your nose. So you want
Yes.
that mask to cover essentially your nose and your mouth.
Yes.
So that's the first thing. And then the next thing would be, of course, really good hand hygiene. So what we were talking about, I'm doing it with my own family as well. Have those hand sanitizers readily available. Of course, soap and water is certainly efficient, and it works for hand hygiene. We're lucky that both are effective for this virus, thankfully. So have a couple of hand hygiene stations posted around the house, in the kitchen. I would even recommend it right at your doorway. So as everybody enters your house, they're already performing hand hygiene as they enter.
Right.
And then
Right.
the next thing, as you're kind of walking through the house too, try to, I know this is going to be challenging, but really try to do that social distancing too. So try to not like be all up in somebody's business, up in your face, right? Try to keep some space.
Right. And especially with, so it gets complicated when you start having other families coming in, you know, that are grouped together. I mean, how realistically speaking are we talking with social distancing, and staying safe at a table? Or, you know, obviously we're inside now. I know it is, you know, recommended, but what are some, I guess, recommendations as well in terms of the size, how far apart we need to be sitting and things like that?
So the first thing would be, we're really lucky to be down in Florida. So if you can, move your Thanksgiving outside. There's
Yeah.
a lot of evidence coming out right now essentially about how important air quality is. So anything that you can do to increase that air quality is going to be beneficial. So if you're still considering to have the Thanksgiving meal, right? Then the next option would be that you have it outside. Or maybe there's only parts or portions of the day that you can have outside. Maybe you don't have a table outside, but maybe the appetizers can be outside. And then
Right.
maybe dessert can be outside if it's like handheld cookies or something to that nature. So the more you can be outside, the better. If it's
Right.
inside, take advantage of our beautiful weather, open up all the windows, and that will help flow. Maybe even turn your fan on low, and that will help that circulation.
Yes. No, we really are lucky. I mean, the weather's just gorgeous this week locally, so that's nice.
Yeah.
But yes, you know, I like that idea of opening windows, or, you know, maybe just keeping as many activities outdoors as we can, even if the
Yep.
kids playing outside, or, you know, whatnot as well. So we have our mask, we have our sanitizer, um, locational table, open the windows. That's great.
Mhm.
What about seating at a table? How, you know, I mean, with people with our own family and immediate family versus people in other families, how can that work?
Yeah, so that's a great question. Ideally, so I think the first thing that I wanted to just quickly mention is that the fact of when you're eating, that's actually going to be considered a high risk process. So when you really think about it, so as you're out and about, if you're just talking to your family and friends, you're hopefully wearing a mask at that point. You're inside,
Right.
you're just talking. When you start eating, think about it. Your mask's down, and now you're going to be eating. You're naturally like expelling more droplets and food particles. most of the time it's microscopic. You're not even seeing it. But that piece, that type of action is considered a higher risk. We're seeing a lot of transmission when people are sharing meals together. So that's the first thing, is just to know that that's a risk factor.
Okay. Well, yeah.
Yeah.
Oh,
So
go ahead.
if possible, when you have multiple families in the home or multiple families on the day, maybe you can use some of those I've got a foldable table, right? So I could put one family at the fold table, another family at this other, at this other table. So if maybe you can separate out by family to your tables, that might help as well. And just during the eating piece, right?
Right, right. Yeah, no, I mean, it really is very simple to do when you think about it. Now, so we go into eating. I'm trying to go step by step here with the table. Now,
Mhm.
serving, we have our serving dishes. Our family, we eat family style Thanksgiving where everything is all
Yeah.
over the table. So it sounds awful to do during this time of year, but what are the recommendations about serving?
So really, yeah, I that's what we do as well, and it's going to be a little funky this year. So really, the best thing would be, so remember thinking about how this virus can transmit. So it can transmit via contact as well. So meaning on our hands. So remember, it doesn't get absorbed through our
Yeah.
skin, but what happens is if you get it on your hands and then you rub your eyes, or then you're eating with your hands and you didn't wash your hands. So the
Mm-hmm.
best thing would be to do is to have really one person serve. So maybe you have a serving line, right? But your line is, remember, you're going to be like 6 feet apart. So everybody gets, as much as challenge. It's going to be really challenging this
I
year. So
know, I
hopefully we don't have
know.
large groups. But if you have one person serving, then that's that same person that's essentially handling the utensils. And then they know to perform hand hygiene before they go and eat.
Right, yeah, because usually everyone's going for the mashed potatoes or the turkey
Right.
at the same utensil. So keep it to one person. I love that.
Yep.
And going down too with the tables, like spacing out, we said the chairs, if you have to be, maybe space them out a little bit, but try to do separate tables per family, the immediate family. As you can see with the table setting here, we were able to still create a fairly nice table setting using some disposable items. We have the chargers here, but we have disposable ware here. I mean, it's recommended that we use this now, we're correct?
Yep, absolutely. And really for the same reason. So the more you're handling things, the more you're going to be touching various things that everybody has touched, those kind of high touch surfaces, then that
Mm-hmm.
increases your risk for introducing it to yourself. The one thing that I'd like to say, I think this looks fantastic. A couple of things to think about, just to throw this out there that I'm seeing right off the bat. So if you're going to be
Yes.
using disposable items, think about
Mm-hmm.
your trash can. So if everybody then has to touch the trash can lid to open it up to throw away, that's not great. So remove your trash
Mm,
can lid if you don't have one of
okay.
those foot
I
pedals.
like that. Okay. Remove the lid. Yes. Good to know.
Yeah.
I mean,
So
it's just the
right.
transmission is
It's
in so
little
many
things.
areas.
It's
I
little things that
know.
add up. So even your table looks fantastic, but I would say actually don't even use a tablecloth. So if you've got
Okay.
your regular table, then you can wipe it down. You can use the Lysol wipes, or any of the disinfectant wipes that you get at the store. Remember to look on the back of those disinfectant wipes and read it. It'll actually say influenza virus and coronavirus kills in XYZ minutes, right? So a lot of them
Okay.
will say 2 or 3 minutes. That means that's how wet the surface needs to stay for it to actually kill the virus. So it's a
Okay.
lot longer and much more challenging to kill the virus on a soft surface like a tablecloth or even a cloth
Mm,
chair than it would be on a hard chair or a hard table.
interesting. Now, is it recommended to use disposable table linens or ones that you could throw in the wash, or just strictly try to eliminate the linen in general?
I would say see whatever works for you. So if you can eliminate, even better. If not, then wash it as soon as you're done your meal.
Okay. Yes, and I mean, if you could see, I mean, you can find these are disposable silverware, so I love that they're so fancy now because you can still make it nice and real. We have a lot of disposable things, which is great. We made this little sign here too that you can put at the front of your home: clean hands and happy heart. So just remember that's a great way for I think the entryway to have that in the beginning or a couple reminders throughout the home and still make it cute and festive. Are there any other tips that you would recommend?
I see your roll of paper towel there. I think that's
Yes.
fantastic. So that's the same thing that I would say even in the bathroom. So everybody in the bathroom is usually using a regular soft towel that we would kind of reusable towel, right?
Hmm.
And you throw in the wash. If you can use a roll of paper towel, that'd be even
Yes.
better.
They actually even have little sets now that come in like a tissue box too. I've seen that you can
Oh,
just pull out one by one. But if not, grab your little paper towel rolls and lay them out or have the roll in there. But I like that
yep.
because, yeah, everyone's always using the same towel,
Yep.
which is
And I
not
would
fun.
say, you know what, the other thing too that will really help, I would designate like maybe one or two people. I don't know if you have an older child or
Hmm.
your husband, if he doesn't normally do much, he can be the one that goes around, every hour or whatnot and just goes wipes down some of the handles, wipes down some of
Yeah.
those common touch surfaces, your light switch, your door handle, the refrigerator handle, things like that, so that that's getting nice and it's getting disinfected frequently.
Right. Now, with the gathering, usually there's a lot of socializing going on. So, is it recommended that if you're indoors or out there, you should have the mask on during in the house, or how far away should we be? Should we have appetizers out in general? Is that high risk having shared food plates? What do you recommend for that?
Yeah, it's a great question. Again, I think these are going to be some of those questions that it's really ultimately up to the host family as well as the visitors. I would really recommend first have that communication with your guests before they're coming. So my hope is if you're inviting families into your home for the holiday, you can have that honest conversation about here's what here's what I expect from my visitors, and here's what I'll be offering. Things like that. That communication is going to be really, really important this year. And I wouldn't say that we always have it, right? And so the second thing would be exactly what you just said. So some of those appetizers, maybe a drink station, things like that. The more that you have crowding, that's what that kind of increases that opportunity for transmission. So maybe space things out so you don't have 4 people in line for your whatever your crab dip or something like that for your appetizer, right? So the more you can space things out, the better. It's going to be a kind of less close interaction and hanging out. In terms of the mask, I would really recommend the general recommendation is if you're going to be within 6 feet of somebody, if you're indoors, you should wear the mask. That's what we would
Okay.
recommend. We of course stick with the CDC guidance. If you're outdoors or if you're unable to maintain a 6 foot distance, then continue that mask use.
Okay. Okay, no, I'm such a germaphobe. So my family's gonna be so annoyed with me on Thanksgiving Day now that I have all this information.
I
But
know it's good and bad sometimes. Yeah. Yeah.
it's so great. But I think we had a couple questions. Let me see the next that came in before this
Okay.
event. Let me see. Okay, so do you have any suggestions for limiting family interaction, especially for homes with small children, in the way that drugs can be spread? I think we talked about this a little, but when you have a lot of kids playing as well, how does that work out?
So I have 2 little ones. I have a let's see, he's a 19-month-old and one that's
Mhm.
just about to turn 4. So I completely understand that question, and good luck to you. Um,
I know.
for the most part, I would say kick them outside. If you've got like a fenced-in backyard, that would be the best situation you can do.
Yeah.
The one thing that I forgot to actually mention at first, in terms of trying to determine who's even coming to your event, there's a couple of really big red flags that I want to make sure that your audience knows. If you have somebody that's coming to the event that has tested positive for COVID in the last 10 days, that absolutely should not be coming,
Yes.
right? Even if
Yes.
they're feeling well, this is going to be, that's kind of that misconception is, I never got sick. I just had maybe allergy symptoms. I'm feeling okay. I'm comfortable to come. Don't let them come. So for at least 10 days, we don't want to let them come. If you have somebody that has symptoms and maybe hasn't been tested yet, also not recommended that they come. So remember, thinking about the challenge with COVID, a lot of our patients are saying they've had very mild symptoms at first. So maybe it was just a scratchy throat, or I was just really tired, and maybe you can attribute it to something else, maybe attributing it to allergies or attributing it to a really hard workout the day before. So if it's really important to tell all of your family and guests, if you're having any of those symptoms, please don't come. Likewise, if you have somebody that that's taken a test because maybe they had an exposure, maybe somebody at work or somebody else in the household that they were aware of, and they're considered exposed, they shouldn't be coming for 2 weeks either. So just because you've been exposed, maybe you tested negative, it can still develop the symptoms while they're, or even develop infection and still transmit it to you and your family while you're together. So there's a couple of really, really important things. High risk family members. So anybody with underlying medical conditions, those grandparents greater than 65 years old, really rethink whether or not they should come to your gathering. Unfortunately, maybe that's who, or make sure that we go outside to have them. I can tell you personally, unfortunately, we're not having my parents over for the holidays, so and it's really unfortunate. I hate it. But I want to make sure they're going to be here for me next year too. So I think there's a couple of those things. I've also heard a lot of people that are essentially getting together, or they're essentially going to get tested before they see their families. One thing to remember, the test that you're getting, that test is only at one point in time. So it's only as good as the specimen that person collects. If I swab the air, big surprise, that test is going to be negative, right? And it's only as good at that time that you test. So it's also dependent upon that type of test. So there's a couple of different things there, right? So if you do a rapid test 2-3 days before Thanksgiving, that doesn't mean you're negative on Thanksgiving. I hate to say that.
Oh, I saw that online. Someone saying that you could test, and just because you're not showing symptoms, they could start a couple days later where you've already shared Thanksgiving dinner with your family.
Yeah. And I had to say that. I had to get on my soapbox and make sure that everybody knows about that. The couple other things that I thought of for the household. So now, like inside too, the other big thing in terms of kind of limiting transmission in the party, this is not the year to have karaoke. So we really don't want singing and kind of really loud, like laughing and screaming. Because think about those same types of things in terms of transmission and droplet. When I'm just regular talking, you naturally expel some droplets. When I'm singing really loud or speaking really loud and I'm over enthusiastic, there's going to be a lot more droplet and a lot more force behind that. So it's going to be much easier to spread and transmit. So that's going to be a couple of things. Or if we want karaoke, it's got to go outside. Everybody's got to be at least 6 feet apart. My neighbors love karaoke, so there's always karaoke at the holidays.
I know. This is the year of everyone can sit on their phones and it's like, okay, right?
Right. I know. That's sad.
And so
actually then speaking about that too, then one thing to think about, which is really unfortunate. I love a glass of wine. But the more alcohol we consume, obviously our inhibitions are lower and we're going to really start breaking away from those good practices. So if you're really good at those infection prevention practices, those public health measures day in, day out, after 2-3 glasses of wine, you're probably not going to be as good. So this might be the year as well to kind of scale that back.
So basically, we need to just come for dinner, eat it outside, and say, thanks, guys.
I know, and just a beer of bad news today. I'm sorry.
No, I mean, it's really important. I think it is because we've seen, we did a Facebook Live at Tampa General Hospital back in March when COVID first was beginning, and it was so informative. And then I feel like we were so strict during quarantine, and now everything is just normal, but it's not. It's worse almost. So it's really scary for me as a mom, and it should be for a lot of people who, it's just how do we start taking it seriously again? So I think educating everyone's really important, and making sure that we're all educated on what to do, because it just makes us all conscious about it. So, I think, people have questions. We'll check and see if anyone submitted questions, but if not, just drop them in. But the videos, we're trying to be super informative too, so that way you have everything. I know that if people, we're on a big break now too, with Thanksgiving and Christmas going on. The kids will be home. I mean, do you have any ideas of safer things for families to do during our break?
Yeah, that's a great idea. I mean, I'll kind of keep going back to the same thing, anything outside. So, we've taken with my boys, they are in school and daycare. So, I think this is also one of those things that everybody really needs to think through their day to day, and what is what's your priority? Where are you willing to take risks and where are you not? So for me, my 2 kids need to be in school. It's impossible for me to work at home with the 2 boys. So that's my risk. I know that puts me in a higher risk situation, but for me, that's my value. So I'm not going out and eating at restaurants, for example, right? So you kind of have to pick and choose. Where do you feel comfortable? What's considered low risk? What's high? So we go to the park. So I've got a couple of classmates with my oldest, and so they're already exposed to each other. Frankly, they're already seeing they're together in class all day. So those are the perfect kids to hang out with. And so we'll go to the park. We've gone to the zoo a couple of times. I go super early before the crowds start picking up. Anything with a crowded situation, really not ideal, unfortunately. It kind of it's impossible to keep that social distancing. And really, when you start seeing the crowds, I feel like I start seeing less mask use too. So there's usually a couple in the crowds that are not great with keeping a mask on, and that mask is just so important. So.
Right. I know we went to St. Pete last weekend. I think I've told a few friends, and it was so crowded outdoors, and it was a beautiful evening. But I brought my mask and I was wearing it outside, which is probably one of the first times I've done that.
Yeah.
But it made me nervous walking behind crowds because, I told you I'm a little bit of a germaphobe, but thinking of people sneezing or coughing and it coming right back at me just made me a little nervous. But that's all great. I mean, we have a lot of resources we'll put in the comments too of safer things to do outdoors, but just keeping it small and try and social distance, I think, is what we have to go back to, the basics, really.
Yeah, I mean, what's interesting. These are the types of things that we got really good at it in H1N1 in
Yeah.
2009, right? Everybody started washing their hands really well, and it
Mhm.
was a good kind of wake up call, and we're kind of there again. So these are essentially practices we probably should be doing all along, and we've gotten away from it. So we're kind of just circling back.
Yes. No, I mean, thank you. This has been so informative. It's really good. So we'll make sure to reshare this out and blast it out to our newsletter for everyone so they can keep, the information. And it's going to be good for the next few weeks as we enjoy this holiday season. But thank you so much, Kim. I mean, I know if you have any other questions, anyone watching this can go over to CDC. And they are a great resource for all the information as well. And then Tampa General Hospital has their coronavirus hub where you can go to tgh.org/COVID. And then you can read all the up-to-date information too. But are there any other resources you recommend, or are those pretty much the best ones?
I would say those are the best ones. There's also another one, APIC. It's APIC, the
APIC.
Association for Professionals in Infection Control. They've got a COVID page as well. That's great information too. So
Okay,
between all of
awesome. So
those, you
we'll
guys will be
submit
set.
all those links. Yeah, no, I think it's really great. So thank you again. I mean, we'll make sure to reshare this a lot because it's always important. And we'll find the Facebook Live we did from March and bring that one back because that one was
That's
all the
great.
tips for families on staying healthy. But this has been great. Thank you so much. I hope you have a happy Thanksgiving, and hopefully we will chat soon. And not hopefully not too much longer about COVID, but keeping everyone safe is
Yes.
always important. So we really
Yes.
appreciate it.
You're welcome. Happy Thanksgiving to you and
Happy
everyone on.
Thanksgiving. All right, bye bye
Bye.
now.